Well, let's return to the Artemis 2 space mission now. Yeah, because the crew have received a warm welcome at a NASA homecoming event in Texas after travelling further into space than any human before during their 9-day mission to the far side of the moon.
Yeah, the 4 astronauts will now undergo a series of tests to establish the impact of the assignment on their bodies. Let's speak now to the space flight expert, Dr. Tess Morris-Paterson. Thank you very much for coming on the programme.
Morning, it's a pleasure.
So talk us through them. What are the kind of impacts, what are the kind of things that they're going to be observing now?
Well, there's things that you'd expect and there's things that you wouldn't expect. So I think we all saw that they were having some help getting out of the spacecraft and onto the US Navy ship. So it's things that you would expect. So we'll go through neurovestibular testing, which is a really fancy way of saying how their balance is doing and how their blood is regulating in terms of their blood pressure. So that'll take quite a while to be able to regulate, between 48 and 72 hours. And there's things that you wouldn't expect. So their eyeballs, for example, because it sounds a bit gross, but their blood goes more toward their head and their chest in space. Again, it takes a while for the body to be able to regulate that, and it takes a while for their eyes to become a normal shape again. So, yeah, these are kind of tests that they're doing now, and it will tell us a lot more about actual microgravity away from the Earth rather than near Earth that we've been used to at the moment.
And I know that's your particular specialist subject, but can you tell us, and apologies if this is a daft question, but how much does that extra distance that they've travelled from Earth, do you think perhaps make a difference to those stresses on the body?
Well, honestly, we don't really know because, of course, at Apollo, they did a fantastic job, but they didn't have the same measurements that we do now. So I was talking about the eyes, for example. So the kind of technology that we have now is mini versions of something that you can measure in space. So, you know, they've actually been sending back live feeds. So the physiologists and all of the team that have been working, the engineers, to relay that data to really understand as quickly as possible, certainly before the next mission goes, what the effect really is on the body. So in terms of microgravity, it's not going to be a huge amount different to near Earth orbit or low Earth orbit where we have been typically, but we don't really know that. So let's find out.
OK, what about the kind of psychological impacts? How do you study that? What will they be looking at?
So I think everyone would have recognised that we've picked, or we as a human race have picked a phenomenal 4 people, and NASA have picked a phenomenal 4 people, and the Canadian Space Agency, to go back to the moon. So I think you can all agree that in terms of the characters that they are, that's really important. I specialise in astronaut selection, so for me it's really interesting to see what kind of psychology they have as individuals. And you need to be really robust because, of course, you're looking back at the Earth and the whole of civilization. So to be able to do that and come back to Earth and to be able to live a normal life again, I imagine it's really difficult. So they'll be undergoing a huge amount of psychological and psychiatric tests, which they would have done, of course, during selection.
Yeah, I was fascinated with Christina Koch's words at that event, that NASA event overnight, when she was saying that one of the things that really blew her mind was the blackness surrounding Earth and just watching it there, suspended like a lifeboat, she said. And it must blow your mind to kind of see the Earth that you live on in that sort of perspective. Can those experiences effectively, I mean, they must live with you forever?
Yes, of course. And we see astronauts after their career and after they've moved on, actually go into completely different things than they did normally. Whereas previously they'd have a career in engineering or science and be, you know, very dedicated to those subjects. Then they might move on to, you know, other things that could be to save our planet. And I think you become more and more aware of that. And I've heard many astronauts say that they wish they could send world leaders up to the moon and actually look back at what a precious life we have here on Earth.
Some people wouldn't want those world leaders to come back. That's the only problem with that plan. Just lastly, I just want to get on the physical side of it now. When we look at next landing on the moon and then potentially going further, is this data collected really vital for that?
Yes, of course, it's incredibly vital because, you know, we spent years collecting data on the International Space Station, but it isn't, or we can't assume that it's similar to going so far away from Earth as this crew has. So we really do need to look after how we support those humans to live on the moon, because of next ambition, of course, is a lunar base. And we can't do that without radiation data that they've collected. We can't do that without human physiology or human psychology data. So this will be imperative to actually setting up a really successful lunar base that hopefully is there to last.
Dr. Tess Morris-Paterson, thank you so much for coming on the programme. Thank you.
Sure.
And you can watch the full story of the mission Artemis 2 Return to the Moon. It's on BBC iPlayer now. Some of those absolutely extraordinary images that we saw from the mission as well, of course, all contained in that one.